Today we're going to get a little up close and personal. I'm going to show you my groin. I strained it while doing some too large of step ups. I'm going to show you how I use the Gua Sha or muscle scraping bow, I believe it's called, from Sidekick. Pretty awesome. My groin strain happened probably about a week ago and it hasn't gotten any better. I've let it rest. I took off leg day. I've done the stretching. All the stretching does is kind of make it hurt. Tried the general exercises that you're supposed to do. Those don't seem to be helping. If I gave it more time, maybe it would help, but I'm impatient and I know how quickly these Gua Sha and muscle scraping bars work. I'm ready to get back to it. So I'm gonna do all that I can to get back to where I was before I strained it. So I present to you my groin, also known as the adductors. Here's some basic anatomy. My quads roughly are right through there. Hamstrings roughly right through there, and we'll just call the rest the groin or the adductors. This is not precise. Don't get fussy with me. It doesn't matter. I'm going to be checking the whole area because rarely is it one muscle. It's not like I strained my gracilis or strained my sartorius. Honestly, I don't care. This is not typically the position I would be in to do this, but I want you guys to be able to see, so that's what I'm going to do. I'm a giver. I'm sacrificing for you. The reason I don't care which muscle it is because I'm going to check most of everything in here. When this first happened and I was doing the step-ups on a box, I just felt a very obvious ping or pull right through that area. I know I did something. I don't know what it was. Maybe the box was too high, weight was too heavy, I was not warmed up enough. I'm just going to use the bow here and I'm going to start exploring with the muscle scraper. This medialis, there's a little bit in there because what I'm looking for is pain and discomfort. I'm looking for what really jumps out at me when I'm using this tool. And right now I'm going at, we'll call it level 1. So it's almost, this thing's nice and heavy. It's almost just the weight of the bar. And again, when I go right down that main bulk of those adductors, boy, I can feel it, and I'm not using much pressure. I'll go down more into the hamstrings here. I really don't feel much. And another thing that led me to, I knew pretty confidently it was mostly just something in the adductor realm, was because when I would do a hamstring stretch, I don't feel it. When I would do a sciatic nerve glide, I don't feel it. When I would do a quad stretch, I don't feel it. When I would do a groin or an adductor stretch, I would feel it. So now that I have that narrowed down, I really don't have to spend much time on the quads. I really don't need to spend much time on the hamstrings. I'm gonna focus right here on those adductors. When I do this technique, I look at levels. Most superficial level, level 1, level 2, I'm adding a little bit of pressure. Level 3, I'm going pretty deep. Level 4, I'm pushing pretty damn hard. Right now at level 1, I'm using the weight of the bar, and I'm gonna wait for that level 1 discomfort to dissipate. And so for the most part, when I get closer to my pelvis, that's dissipated. This spot right here, I would actually say that's kind of a junction of where my quads end right there, and then the adductors go in together. That's still got a pretty good bite to it. So I'm gonna hang out in that area at level 1 until that dissipates. Sometimes that could be a minute. Sometimes it could be a couple minutes. Cool thing about this technique is sometimes even being on top of it, because like I said, it happened about a week and a half ago. This is still doing a lot of healing, or at least trying to do a lot of healing on its own. So I may only need to go to level 1 and then it may fully recover on its own. Sometimes I may need to do level 2. Right now, I'm actually starting to go to level 2. It's not as bad as level 1, so that's a good sign. But as I go to level 2, right there, that's showing up. Level 1 right here did not show up, that more superficial layer. And now as I go to level 2, and I push in there, and even with my finger, I can feel that that's got a little bite to it. Then level 2 up here, I would almost say nothing. It is like 80% improved, 90% improved up there. The level 2, this area right here, that kind of makes it hard to talk. Okay, that's already starting to dissipate, so that's good. Right now I'm using, call it the more, I don't know, concave, convex, nobody knows. I'm using the top arch, what I'd call, versus the inside arch. So that's pretty well cleared out for the most part. I could actually be done, if this was an acute injury, I could be done with that, give it a few days to a week, and then come back and see how it does. Still working out, that's the great thing I love about this technique, is I can still work out. I just worked out. I didn't focus on any of this, but if I wanted to work out later today, I would tell my clients, go ahead, test it out, see how it's doing. Just for funsies, I'm gonna go ahead and push to level 3. See what else we got while we're in here. Honestly, not as bad as level 2 and level 1 was. There's still some goods in there, but not the worst thing in the world. So I'll just get these cleaned up. And as I'm doing this, I'm going back and I'm kind of scanning the whole area. Does anything else jump out at me? Because up in here, I'd call it the top of that hamstring, bottom of the adductors, there's a little something in there. Again, on my end, it kind of feels like a bee sting, maybe a pissed off nerve, maybe a pissed off tendon, maybe a pissed off muscle. I don't care, they all need blood flow. And I would honestly say that's done. I'm done, I can move on. I gotta go check my sweet corn, make sure my chickens didn't get to it. And there you guys go. That's how I deal with called a late acute or early subacute muscle strain. I don't care where it's at in my body. If it's not getting better, which this one was not, at least not as fast as I wanted it to be, I jump right to these, get in there, increase some blood flow, help the body heal and recover quicker. And don't judge my white legs. I haven't got to be outside yet.